Hi, so my topic is drug resistant tuberculosis. First, to figure out what drug resistant tuberculosis is, we need to understand what tuberculosis is. Tuberculosis is an infectious disease that mainly affects your lungs. The bacteria that causes tuberculosis spreads from one person to another through tiny droplets released in the air via coughs and sneezes. Some symptoms of tuberculosis are coughing up blood, fever, chest pain, and death if not treated. This is a very contagious disease, and there is two types. There is latent TB, where you have germs in your body, but your immune system keeps from spreading them. You don't have any symptoms and you're not contagious, but the infection is still alive and can one day become active. And sometimes there are things like you can have a cold or whatever, and it can become active quicker and you can be spread easily. And then the second type is active TB. The germs multiply, make you sick, and you can spread the disease to others. With the invention of antibiotics, there was a way to stop tuberculosis from spreading. Many believed it to solve all the problems. This is not the case, though. Like many things in the world, to be successful, it needs to adapt. This is exactly what the virus did. The virus gained the ability to become drug resistant. So, what exactly does that mean? That means the bacteria is capable of altering the enzyme targeted by antibiotics and uses the enzymes to modify the antibiotic itself to neutralize it and become no longer effective. This is not a good thing as it can start another pandemic with no cure readily available. There are two types of drug-resistant tuberculosis. First is multi-drug resistant tuberculosis, which is caused by tuberculosis bacteria that is resistant to at least isoniazid and rifampin. Those are the two most effective drugs for stopping tuberculosis. The second type is extensive drug-resistant tuberculosis. This is a rare type of multi-drug resistant tuberculosis that is resistant to isoniazid, rifampin, fluoroquinolone, and at least one of the three injectable second-line drugs. The second-line drugs include amikacin, chamiacin, or campryomycin, which are most possible options for stopping tuberculosis. You might be wondering how common it actually is. In 2016, I found that 8,000 patients with extensive drug-resistant tuberculosis were reported worldwide. There was 123 countries that reported at least one case of extensive drug resistance. I also found that in 2016 there was an estimate of 480,000 new cases of multi-drug resistant tuberculosis, with 240,000 people dead globally from it. As I found, it is possible to cure these two types of drug resistant tuberculosis, but it takes a very large toll on the patient's wallet. In direct costs in 2016, an average for multi-drug resistant tuberculosis to be treated was about $18,000. For extensive drug-resistant tuberculosis, it could be up to $500,000 just to treat the tuberculosis. These treatments take an extensive amount of time and they use second-line drugs. Second-line drugs are expensive, rare alternatives and have a lot of side effects to come with them. To have a successful diagnosis and a treatment of these drug-resistant tuberculosis types, they must have a rapid and precise drug sensitivity test. The drug sensitivity tests are molecular tests that detect genes related to the drug resistance. They do this to determine what drugs can be effective and how much they exactly need. There's a lot of tests they can do, it just differentiates on how much money they can spend on them to determine the amount of time to get a result. A lot of the tests I found, for example, the conventional phenotypic drug sensitivity test that uses a solid culture-based method, had a turnaround time of 2 months. This is a lot of time without a treatment. The whole time you'd have to be quarantined to not spread it to others as well. Not to mention, most of these cases are more common in poverty-filled areas, and many could not afford these kind of medical bills. So how does bacterial tuberculosis become drug-resistant? In my research, I found that drug-resistant tuberculosis has a pretty interesting foundation. The bacteria has natural defenses against a few drugs and become drug resistant from gene mutations. The bacteria does not have the ability to transfer genes for resistance between organisms through plasmids, but one way they can is through spontaneous mutations. These mutations can alter proteins which are targets of these drugs. The cell wall of the drug-resistant tuberculosis bacteria contains complex lipid molecules which can protect drugs from engaging into the cell, making them free to continue to spread and infect the body. So why do these mutations occur? One way is from a process of selective pressure. This is the process in which microorganisms are killed via medication, and the ones that survive off the gene mutate and replicate. This can occur from inappropriate use of antibiotics. For instance, healthcare providers will prescribe antibiotics inappropriately to help a patient with a viral infection or an undiagnosed condition. This has the possibility of not getting rid of the disease and having the bacteria adapt and become drug resistant. A similar situation is inadequate diagnostic, which is when the healthcare provider prescribes the wrong antibiotic or just a general antibiotic that's not strong enough. Another major factor is just being exposed to too many antibiotics. That can be from being prescribed them every time you're sick or just in your food. I found an interesting statistic that more than half of the antibiotics produced in the United States are used for agricultural purposes, like our food. For a real-world application, I found an article that shows how quickly this bacteria spreads. It was an article by the University of Minnesota that they started interviewing and reviewing the medical records of 404 patients in the KwaZulu-Natal province of South Africa who had been diagnosed as having extensively drug-resistant tuberculosis from 2011 to 2014. Participants were then asked to name contacts at home and work and other community settings who they've been in contact with. The researchers performed genetic sequencing of fingerprinting of isolates from each patient to determine whether the various strains matched. The results found that 70% of the patients had no history of treatment and appeared to have acquired extensive drug-resistant tuberculosis through direct person-to-person transmission. These patients had never previously had tuberculosis or had been exposed to tuberculosis drugs. This can only get worse over time if we don't figure out a solution for this drug-resistant bacteria problem. This is why it is important that people are aware of the outcome of too much antibiotics and what happens when they are not used properly. To be successful, we need to only use antibiotics when necessary. Always take the full amount when prescribed. Have an accurate and organized healthcare institutions, as well as a plan for quarantining if it continues, as this can happen to many other bacteria. I wanted to say thank you for your time on learning more about drug-resistant tuberculosis. All right, goodbye.